For Patho, Lauren and I did our project on rhabdomyolysis, also known as rhabdo. Rhabdo is the breakdown of muscle tissue leading to the release of muscle fiber into the bloodstream. The proteins and electrolytes released in the blood can cause organ damage, most likely to the kidneys, leading to kidney failure. It is very harmful, leading to kidney damage, and myoglobin is that protein that is released via the bloodstream and filtered out to the kidneys, breaking down the kidney cells. Here is a short video we're going to show you, talking a little more about rhabdo and its condition.
Earlier this year, 13 football players from Iowa were hospitalized with rhabdomyolysis. It's a condition that can happen for several reasons, including if you exercise too hard, especially in the heat. Severe cases can lead to kidney failure. The man you're about to meet knows the dangers of rhabdomyolysis firsthand. It happened to him after an intense workout.
I was doing a workout.
Push-ups, sit-ups, lifting weights. Jerry Holacek pushed himself hard and too many reps when he started a new workout program.
My arms were really sore. Triceps were really tight. I couldn't even bend them this far.
Then his muscles started to swell and his urine was dark.
Essentially, the muscle broke down.
Rhabdomyolysis means that you develop an insult to the muscles. And when that happens, if it's severe enough, it can lead to kidney failure.
Dr. John Graves says this is what happens to your body. Injured muscles break down and release a protein called myoglobin into the bloodstream. This protein can damage the kidneys and it can also block the conduits that produce urine. Plus, damaged muscles swell and become a reservoir for fluid, causing dehydration and further insult to the kidneys.
It's extremely dangerous because the rhabdomyolysis insult often is unrecoverable. So that the first thing you'll notice is the severe pain in your muscles, and the next thing you'll notice is very dark or Coca-Cola colored urine. Once you recognize that, immediately proceed to your doctor. The most important thing your doctor will do then is try and counteract the dehydration and maintain a high level of urine flow, trying to flush the poisons, the heme protein out through the kidneys.
I actually was admitted into the hospital and spent the weekend in the hospital because they were afraid of kidney failure.
After treatment, constant IV fluids, Jerry recovered. No permanent kidney damage. Now, almost 3 months after his illness, Jerry is getting back into an exercise routine.
I'll just gradually go into it so it doesn't happen again.
Dr. Graves says rhabdomyolysis from working out is pretty rare, but it is important to know the signs and symptoms. Other causes of this condition include muscle trauma, as in an auto accident, and drug and alcohol abuse. For Medical Edge, I'm Vivian Williams. Earlier this
Some causes and risk factors of rhabdo. Trauma and crush injuries are the most common because rhabdo can occur from any muscle that is damaged, overexertion, which is that eliminating waste, drugs and alcohol abuse, genetic disorders, and severe hydration. Hydration doesn't cause rhabdo, but it can make it worse. Also low phosphate levels, lengthy surgical procedures, and seizures.
Some incidents regarding rhabdomyolysis that is actually more common in adult males. It's more common in adult males because males are more likely to have traumatic injuries than females are. It's also more common in African Americans. It's more common in African Americans because of that sickle cell trait that some of them carry. It's also common for them because of their increased body mass. Children with Duchenne's muscular dystrophy can also develop rhabdomyolysis due to the muscle fibers breaking down. So with Duchenne's muscular dystrophy, their muscle fibers are breaking down, which then can lead to rhabdo. Other incidences are obese patients, patients younger than 10, older than 60 have a higher chance of developing rhabdomyolysis.
Some signs and symptoms of rhabdo is muscle cramps, aches, or pains caused from that damaged muscle. They could have a dark urine from dehydration. It could be tea or cola covered. Feeling weak and tired, and some may be asymptomatic where they show no symptoms at all.
So rhabdo is diagnosed by a physician must have a complete and thorough medical history and a physical exam to suspect rhabdomyolysis. Just like we said before about risk factors, trauma, sepsis, muscular diseases, medication, and drug use are common indicators that someone has rhabdo or will be developing rhabdomyolysis. A complete blood count, metabolic panel, urine analysis, and muscle enzymes will be used to diagnose rhabdomyolysis. Regarding the metabolic panel, it's just a blood test that measures your glucose levels, electrolyte and fluid balance levels, and also your kidney and liver function. So diagnosis of rhabdo is confirmed by the muscle enzymes in the blood. So what they're looking for with the muscle enzyme in the blood is the creatine kinase is the main enzyme that they're looking for. A normal person, our normal level of creatine kinase in our body would be around 22 to 198 units per liter. So obviously when these levels rise, the muscle is being destroyed by rhabdomyolysis or a chronic or acute muscle condition. So treatment for rhabdo, our number one goal and main goal is to avoid the acute kidney injury. So early management is very key before we have any damage to our kidneys. Provide aggressive fluid therapy early due to the severe hydration that they can experience. Removing the causative factor is very important. So depending on the underlying factor, whether it's discontinuing the toxic medication that they're using, replacing electrolytes or fluids, or treating the underlying muscle disease. Hospitalization may be needed for rhabdomyolysis in some severe cases. So regarding special implications for ourselves, initial strenuous physical activity should be avoided to prevent any further muscle injury. When they're able to exercise again, they should avoid exercising in the extreme heat. It is also important to keep our patients hydrated and also educate them on the importance of hydration. Some patients following rhabdo will take months for their muscles to recover and may have residual pain for years. So this is really important when if we have a patient who had rhabdomyolysis or has rhabdomyolysis, this will indicate on what exercises they can and can't do and the intensity as well. So other special implications that we need to look out for. So when this individual when they start their rehab, we want to prevent the contracture program. We'll start a contractures program with range of motion exercises, active and passive range of motion occurring in the affected muscles. So that we would just have the patient do light bicep curl without any weight. So just some flexion and extension exercises of their elbow, their shoulder. It can be their hips, knees, again, whatever muscle groups are affected. So then they would progress into aerobic training. So again, like I said, depending on the muscle group affected, the patient can use a bike to cycle or a row machine. After aerobic training, we will move into gradual resistance training in order to maintain functional activity. So isotonic strength training and a bicep curl with bicep curl with weight is the current best evidence supports a submaximal strengthening program in order to prevent rhabdo from reoccurring. So they're just doing that moderate exercising. Because like I said previously, that they can have muscle soreness and muscle injury for a while after this. So the overall prognosis of rhabdomyolysis is very favorable. Early recognition and treatment is essential. We want to catch it before it reaches that acute kidney damage. Most causes of rhabdomyolysis is reversible. Severe cases may be associated with kidney damage, electrolyte imbalance, and even hospitalization may be required. In some severe cases, the mortality rate of rhabdo is 4%. And here are references.